Hello, I'm Dr. Ruth Roberts, the original holistic pet health coach. For those of you that don't know me, I have been a veterinarian for almost 34 years, which is a little strange to say. But what I've been doing is studying traditional Chinese veterinary medicine and functional medicine and practicing them for dogs and cats since 2005. So today I want to talk to you about something that you probably know is going on, but maybe you're not aware of what it is because nobody's really put it together or put a name to it. So it's what I am calling spay-neuter syndrome. So let's talk about that a little bit because it is a new concept. So if we think about the incidence of cancer in the United States, right now, the American Veterinary Cancer Society estimates that dogs over the age of 10, 50% of them will develop a malignant cancer within their lives. And in general, it's 25% of all dogs. So if we contrast that with the Italian Dog Cancer Registry, where the incidence of cancer is 1.1% in male dogs and 3.26% in female dogs, that just gets a little crazy, right? But that's not the worst of it. Unfortunately, we're seeing that chronic disease is absolutely rampant. And we're seeing that in kidney disease, liver disease, joint disease, inflammatory bowel disease. And sadly, we are seeing this as young in dogs and cats as young as 10 months old. So why is this? This is something I'd been puzzling over for many years. I went from being able to take out a hemangiosarcoma from a dog's abdomen the size of a basketball, put it into the trash can, clean out the dog's abdomen, and everything was okay. To 3 to 5 years later, a dog is diagnosed with a hemangiosarcoma the size of a golf ball, and that dog is dead in 6 months. We had some early clues, and I knew that this dramatic increase in canine diseases was somehow related to the removal of the reproductive organs, but I didn't understand how. So in 2013, when the first paper came out from University of California, Davis, I realized spay-neuter programs could be a primary contributor to this problem. Kudos to them for dramatically reducing pet overpopulation and suffering. However, enter the law of unintended consequences. Spaying and neutering pets drastically increases the level of luteinizing hormone, or LH. In fact, it is 20 to 30 times higher than that of intact pets. And LH receptors develop on tissues and organs that shouldn't have them, such as our brain, our joints, our skin. In intact pets, estrogen and progesterone and testosterone act as the feedback mechanism to tell the hypothalamus, hey, we're all good here. Shut down GnRH, or gonadotropin releasing hormone production for now. Or hey, we need a little more, crank it back up. LH matures eggs and sperm to help mammals reproduce in intact animals. And normally there are only LH receptors on the ovaries and the testicles. But when reproductive organs are removed, there is no shutoff valve for LH production. So the body starts making receptors in places where they should not be. And how do they affect the body? To answer that question, we have to ask, where are the LH receptors? And it turns out they're on the adrenal cortex, the blood vessels, in the brain, in the GI tract, in the ligaments, in the cartilage, in the bone, in the lymphoid tissues, in the skin, and the white blood cells. And then what happens? We see things like hair cycle arrest, puppy coat syndrome, diabetes, hypothyroidism, Cushing's disease, Addison's disease, cranial cruciate rupture, urinary stones, intervertebral disc disease, hip dysplasia, fear and behavior issues, prostate adenocarcinoma, oddly, in neutered dogs, more common than in intact dogs, and then transitional cell carcinoma in the bladder, and then the tumors we all hate, osteosarcoma, hemangiosarcoma, lymphosarcoma, and mast cell tumor. So if you're watching this, have you had a pet with one of the conditions listed? I have. How about two? More than two? This is the problem we're facing. But to solve this problem, what can we do to reduce the luteinizing hormone that seems to be a precursor to this hopefully avoidable increase in these diseases? Thanks to Dr. Michelle Kutzler for discovering not only what was going on, not just ways to reduce luteinizing hormone production, but how to shut it off entirely. If we can do this, we can relieve the symptoms and perhaps even prevent or reduce the incidence of these diseases. I was speaking with Dr. Peter Tobias during a holistic dog health seminar we were holding, and he was talking about his dog Pax. He thought he had Pax's health completely dialed in. Raw diet, optimal supplementation. He was brilliant, beautiful, and shiny at 2 years of age. He hit the 24-month mark. He got Pax neutered. Over the coming months, what he saw was that Pax's coat wasn't so shiny anymore. And then Pax started being weak and not able to go for very long hikes. Finally, they were hiking, and he asked Pax to come out of the vehicle they were in, and Pax literally collapsed. Dr. Tobias started doing some research, and he found Dr. Kutzler's work. And so he gave Pax an injection of suprelorin, or something to control the gonadotropin-releasing hormone production. And over the next several weeks, he saw Pax return to normal. There are other ways to approach this with testosterone supplementation, with estrogen supplementation, but hormone replacement therapy for dogs hasn't really been developed very well, although there are folks out there trying. I've known for years that I have methods that we've used to help support pets not have these issues. I didn't know exactly what I was supporting against, though. So here's an example. As a functional medicine practitioner, I'd been recommending feeding a whole food diet to pets for more than 18 years. My anecdotal evidence and scientific research proved it worked. People were coming into my office and saying things like, "Doc, the itching's gone. Doc, my dog has a normal poop for the first time in years. And Doc, my dog plays fetch like he's a puppy again." I even had clients come into my office who were referring friends that weren't clients, and they told them to get a copy of the recipe that made their dogs feel better, on top of what I was seeing every single day with my clients and their pets. This article shows research on the effect of whole food diet, changing both the microbiome and gene expression. So I knew I was on the right track. But nobody ever wants to hear the best way to improve your pet's health is through whole food, especially if you have to cook it. For example, Kathleen, a top specialist in infectious disease at the Medical University of South Carolina, came in to see me with her dog, Charlotte. Charlotte was a 4-year-old Labrador retriever eating conventional kibble, following all the conventional vet's recommendations, and starting to show her age. Now, if you agree that every dog year is about 7 years in human life, then a 4-year-old dog is in her late 20s and early 30s in terms of human years. That dog should have been in the prime of her life, not acting old. Kathleen was concerned, so she came in to see the woo-woo vet. So I started offering her options. I suggested we do a blood test to show Charlotte's immunity levels instead of giving her a vaccination. She agreed. I suggested she minimize the amount of chemicals being put into and onto Charlotte, such as flea medicines. She agreed. And then I told her the most important thing you can do is to cook for Charlotte. She did not agree. She looked at me and said, "That's impossible. I don't have time to cook for myself, let alone for Charlotte. I said, I understand. And I work up to 12 hours a day, and I'm still able to cook for our 10 pets, and it only takes me 4 hours once a month. And another option is every 2 to 3 days, you could make a full crock pot of food for both of you. Half for you, half for Charlotte. She laughed and promised to try it. So fast forward 10 years, I was speaking with a friend from Charleston who told me that Kathleen had indeed begun to cook for Charlotte. Charlotte lived 10 more years with virtually no health issues and died at 14, an astonishing lifespan for a Labrador retriever of what we would call natural causes. But many of you know there's another way, or you wouldn't be there. So what I'd like to propose to you is the 4 C's to help keep our pets healthy, to support our already spayed and neutered pets. Chill, cavort, clean, cook. Number 1, chill. Promise me that for 3 minutes a day, you will put your phone into airplane mode, go outside, sit on the grass next to a tree with your dog, and do absolutely nothing. Your dog craves your undivided attention and needs you to enter a state of calm and peace. If you relax and lower your cortisol and stress hormone levels, your dog can relax and do the same. If we move from a place of chronic stress to a place of calm, this is the first step into moving into a state where the body can heal. This is moving from sympathetic fight or flight state to a parasympathetic rest and digest state. Number 2, cavort. Exercise is the cure for almost all our woes. It's been shown to diminish the symptoms of depression, anxiety, and many other psychological disorders. It can also improve our body's ability to detoxify by getting blood flowing through all the tissues, providing nutrition, and assisting the cells in clearing the waste products. It's been shown to improve digestion, improve the gut's ability to move food through the GI tract efficiently, and improve the diversity of the microbiome. And guess what? This applies to our pets as well. Number 3, use a water filter that removes chlorine, herbicides, pesticides, bacteria, and cysts. Clean water is critical to maintain health and to return to it. Ideally, this filter would also remove micro or nanoplastics. This daily barrage of chemicals assaults your dog's ability to have a normal immune response and also impacts its microbiome. Number 4, cook. Feed a minimally processed whole food diet. Socrates didn't say, let food be thy medicine and medicine be thy food. He said, in food, excellent medicine can be found. In food, bad medicine can be found, and good and bad are relative. This means that you must find what serves your dog best. And it also explains why so many superfoods turn into super nightmares if your dog is sensitive to them. So what is a minimally processed whole food diet? It can be a raw diet, but in my hands, it includes lots of vegetables, whole, organic, GMO-free grains, and beans with high-quality animal protein and healthy fats. This provides a rich assortment of high-quality nutrients the body is starved for, and when it's cooked, it's in a format that it can digest and assimilate. It can massively improve the diversity and richness of the microbiome, provide the polyphenols that are so necessary to feed the good guys in the gut, and improve the gut's ability to detoxify. So what are polyphenols? You've been hearing for years to eat the rainbow. Polyphenols are the rainbow. They are also the natural prebiotics, not just fiber. If we look at a list of these polyphenols and think about this list of benefits reads like the laundry list of longevity supplement benefits. Now, I think that the 4Cs apply to all of us, humans, dogs, cats. But what if you already have an intact pet and you're struggling with what to do next? There's several things you can do. Supralorin, which is a GnRH inhibitor, is something that is approved for use in ferrets in the United States for hyperestrogenism. In almost every other country in the world, it is approved for use as a chemical castration. Because it is an implant, depending on the size of the implant, it's used up within 6 to 12 months. So it is something that you would have to repeat, but it allows your dog or cat to keep its gonads, which keeps its physiologic levels of sex hormones in much better shape and prevents LH production from skyrocketing. You can also delay surgery, again, at least till 24 months of age. And based on research from a longevity researcher looking at Rottweilers, he would say at least till 5 years of age. And frankly, if you've handled an intact animal for 5 years, probably you can handle them for the rest of their lives that way. And then lastly, the Paramesis Foundation has developed ovary-sparing spay and vasectomy techniques for veterinarians to use in lieu of spaying and neutering. Now, these guys will still behave as if they are intact, but they are indeed sterile and cannot reproduce, so that we don't make that pet overpopulation problem we experienced 30 years ago come back to the forefront. There are some potential health issues that you do need to be aware of if you keep your pet intact. In dogs, male dogs, you need to be aware that prostate disease, prostate infection, and benign hyperplasia can be an issue. Cancer can also happen, but again, oddly, prostatic adenocarcinoma is higher in dogs that have been neutered already than they are in intact dogs. Pyometra is an infection of the uterus, and it can be life-threatening. Current research says that approximately 10% of all female dogs that are intact will develop pyometra. Clinically, when back in the good old days when 90% of the dogs and cats that I saw were still intact, I would say it affected maybe 3% of the dogs out there. And then lastly, in female dogs, we do have to be aware of breast cancer. Now, the interesting thing is that 50% of dogs with breast cancer have benign tumors, meaning, yes, we can feel a lump there, but physically and physiologically, it's not impacting the dog. Of the remaining 50% that are malignant, half of those are metastatic, meaning they will travel through the body. The other half stay local. So again, if we refer back to the incidence of cancer in the Italian Dog Cancer Registry, 1.1% of male dogs, 3.26% of female dogs develop cancer in Italy, a country where spaying and neutering is very uncommon unless it's medically necessary. I will take that over 50% of dogs over the age of 10 developing a malignant cancer all day long. Lastly, I want you to consider that many facilities that you may be used to going to or want to go to with your dog will not accept intact pets. These include dog parks, boarding kennels, and doggy daycare. Now, the reason is that their insurance companies don't want to insure them if they have intact pets in the facility, because the perception is these animals will be more aggressive. So if you know that you want to allow your dog to stay intact for longer, I think it's important to work with a pet sitter and a dog trainer that can come to you or that is willing to work with you and your pet as an intact pet. So the deal is that all over the world, there are so many more pets that are intact. And yes, there is a pet overpopulation problem, but these dogs have learned how to live together in a society and be polite and educated. Now, lastly, I think that's a really simple plan, the 4Cs, but I think there's a few more steps that you need to be aware of and to add in. Again, one of the things where I work primarily is in functional medicine. And while that has systems of function altogether, there's three that I work in on a daily basis for pets. The first is detoxification. The second is assimilation and digestion. And the third is controlling inflammation. Now, out of all of these, detoxification, I think, is the most important right now because we are continually exposed to a barrage of all sorts of toxins. So if we think about how that affects the body, in a normal situation, any cell has hormone receptors for myriads of other substances besides LH, estrogen, progesterone, and testosterone. So, for instance, melatonin is really more of a hormone than it is a supplement when it gets to the body. What happens normally is that a hormone will go and sit on the hormone receptor in a cell and cause that cell to make the response that it's supposed to do. When we have hormone mimics, things that act like estrogen or other substances in the body, plastics, all sorts of crazy stuff, what they can do is to continue to make that cell do that response much faster and much longer than it would if it was experiencing a normal endogenous or internal hormone sitting on those receptors. And then lastly, these toxins can be hormone blockers. And what that means is that they come and sit on the cellular receptors, but the cell is unable to make its normal response. The reason this is so important is that the Environmental Working Group estimates that dogs carry a toxic burden up to 68 times that of humans, and cats 93 times that of humans. So their exposure is much, much higher and much more intense than ours is. And what are these toxins? So the thing to remember is that the EPA has registered 85,000 chemicals, and we know that at least 794 of these are toxins. So I want us to focus on a few that are the biggest issues. So the most common disruptors that we're familiar with in our environment are things like bisphenol A, dioxins, perchlorate, PFASs, or forever chemicals, phthalates, phytoestrogens, polybromated diphenyl esters, so PBDEs, and then PCBs, polychlorinated biphenols, and then triclosan, which is a disinfectant. So where do they come from? I think one of the other big ones is microplastics. We know now that there was a group studying visually how many placentas had visual evidence of plastic in the placenta. As of 2021, and these are human placentas, 100% of the placentas contained microplastics. So that means that 100% of us have plastics in our bloodstream and in our tissues. Microplastics are estrogen hormone mimics, and almost all plastics, even if they say they're BPA-free, leach these chemicals. They are now found in both fresh and salt water, fish, sea salt, and us, and frankly, everything we are eating or exposed to. They've entered our food chain from the bottom up, and sadly, they carry other chemicals like PCBs and pesticides with them, and then they're stored in fat cells. So if we're heavy, we have more plastics, more chemicals floating around our system that can create havoc in our bodies. Glyphosate is a huge problem that we're aware of, and it is in the hydrogeologic cycle. What that means is we may have sprayed it in the United States, but in France, a country that uses minimal amounts of glyphosate, 50% of sperm samples contain glyphosate. So what's happening is we spray it, it gets knocked down into the soil with the rain, it goes into water, whether that's fresh water or salt water through runoff, and then over time it's vaporized into the atmosphere, it gets into those water droplets and forms into clouds. And then when clouds rain, we're dropping the glyphosate back into the bodies of water, on the land, on our skin, on our animals. Now, we can look at glyphosate and insert DDT and PFASs here. DDT, if you're not familiar with it, is a pesticide that was banned in the United States in 1968. It is still in the blood, cord blood of children being born today in the United States. And then we can have a similar concept with arsenic and the heavy metals. Most of us know that there's a higher concentration of arsenic in rice because it's grown in water. But I think if we started looking at all of our food, we're going to see arsenic and other heavy metals to some degree in almost everything we eat. So in fact, anything that you've seen in the news that's bad follows this hydrologic cycle. So I know this is really depressing, but there are things that you have control over. And remember, step number 3 of the 4 C's is clean water. Use a filter that's going to remove as much of this stuff as possible from what you're drinking, from what you're cooking with, and ideally from the shower so you're not bathing in it and your pet isn't either. So you do have control over a few other things. If you're using Teflon pans, get rid of them. The glue that holds the Teflon to the pan is toxic. When these things came out in the 80s, it was killing pet birds. And so we would tell pet bird owners, don't get Teflon pans, but that's where it stopped. So chronic exposure to this adhesive can't be good for any of us, right? Look at your cleaning supplies. Do they have words that you cannot pronounce? Then go back to using things like vinegar, back out, which is a bacterial cleaner. Look at air fresheners. They are aerosolizing all sorts of chemicals. You're breathing these in. Look at flea meds. Look at packaged foods. In pet food, the highest concentration of AGEs, or advanced glycation end products, is in dry kibble that has a plastic liner. AGEs do exactly that to us. They cause us to age. And then the other big thing we have to do is support the detoxification system. Now remember, the number 1 organ of detoxification is actually the lung. It will remove something like 80% of the toxins that are in your body. However, that isn't so effective when you're also breathing them back in. We think of the liver and the kidneys as the main detoxification organs, but in truth, it's the gut. And I'll talk about that a little bit more in a moment. So detoxification is extremely important because, again, pets have a much increased exposure to environmental chemicals as they're lowered to the ground. They're sniffing up these contaminated dust particles, and they have pesticides applied directly to their skin, or they're taking them orally. And those are meant to stay in the body for 30 to 90 days, depending on the product. And then lastly, again, because they are spayed and neutered early in life before they develop endocrine competency, their body never functions 100% normally. So this is Jagger. He is a 10-year-old neutered border collie cross. His mom, Natalie, is one of my holistic pet health coach mentors. She thought he was feeling fine, took him in for his annual visit to the vet, and had some lab work done. But the lab results were absolutely shocking. One of his liver enzymes, ALP, was over 3,000. His ALT, another enzyme, was 557. These are astronomically high values. His vet recommended testing for lepto and Cushing's disease, which are 2 very common causes of liver enzyme elevation. He had already started eating a home-cooked whole food diet and was being fed foods that Natalie knew he was not sensitive to by using a food sensitivity test. She stopped all the supplements because we suspected that there was some sort of contaminant in either supplements or what he was being exposed to. She added in liposomal glutathione, which is the master antioxidant for the liver, milk thistle, and a toxin binder. A week later, her vet asked Jagger to come in, and do an ultrasound, and that showed a very small mass on his liver. So because of this, Jagger was referred to an oncologist. The oncologist didn't think that the ALP elevation was due to this mass, but she did offer a CT scan to prepare for surgery if Natalie chose that route, which Natalie declined and opted to monitor his liver enzymes and the tumor on ultrasound. A CT scan would have required anesthesia. 3 weeks later, his ALP had dropped by more than 60%, and his ALT was now normal. At her old vet's office, they still wanted to test for Cushing's, but Natalie declined politely. Because she was still concerned about cancer, Natalie created a low methionine diet for Jagger and added in probiotics and omega-3 fatty acids and started using a PEMF, a pulsed electromagnetic field mat, daily on the accelerated healing setting. Jagger was feeling amazing with more energy than Natalie had seen in some time. She was washing his feet carefully when they came in for walks, because this was during the winter when there was still salt all over the sidewalks. A little over 6 weeks after the initial lab results, Natalie took Jagger to a new internist who recommended ursodiol to speed the liver-clearing toxins and repeated labs. Jagger's ALP was now 548, down over 80% from the initial level and only 300 points above level. Jagger will go back to the vet very shortly to recheck his labs and the ultrasound. So any guesses on what happened to Jagger? We thought he had an acute toxicity from either a supplement or the salt used to de-ice the sidewalks. And it turns out that many of these de-icing salts are made from fracking brine. That's right, the stuff used to pump shale oil out of the earth, and they're contaminated heavily with radium. By saying no thank you to the Cushing's test and the CT scan, Natalie saved Jagger from anesthesia and a potential wild goose chase on a positive Cushing's test. And more importantly, she found the right vet to support him. Now, I mentioned earlier that the gut is the biggest detox organ in the body following the lung. So while we do need support for the liver, we also have to make sure the gut is functioning normally. That brings us to the next part. Assimilation and digestion is absolutely critical because pets develop leaky gut syndrome too. Many pets that have skin disease have it secondary to leaky gut. Inflammatory bowel disease or syndrome is extremely common in dogs and cats, and sadly, IBS can often progress to intestinal lymphoma, especially in cats. When we say leaky gut, we know this pet is dysbiotic, meaning that its microbiome is out of balance. This is Finn, and he is a 10-year-old sheepadoodle whose mom, Maggie, was working with Michael Daly, a canine massage therapist, and another of our holistic pet health coach mentors. Finn had arthritis in his shoulder, and he'd had surgery for a ruptured disc in his thoracic spine. He was still in terrible pain. He was also had a long history of allergies and anal gland issues, and indeed had been on Apoquel, an immune suppressing drug to control allergy symptoms, for more than half his life. He was also eating a hydrolyzed protein dry food and was on a joint supplement. When Michael first saw Finn, he saw a very depressed dog that looked much older than his years with a dried out coat. His mom was really worried about him. Michael helped Maggie convert Finn to the original Crock-Pot diet, a home-cooked whole food diet, add in a probiotic and a supplement to help reduce itching, to help control the allergy symptoms called quercetin. Michael told Maggie that it could take a while, but he believed that he might be able to help her get Finn off of Apoquel. At his next visit 2 weeks later, Michael saw a much brighter and more comfortable dog. He was completely off the hydrolyzed diet at this point with no increase in allergy symptoms. Finn had short relapses as allergy season kicked into high gear, but Michael was able to help Maggie navigate those relapses without a vet visit. 3 months in, Michael did a food sensitivity test and found sensitivities to some of the items already in his food, as well as to glucosamine and chondroitin. These are in joint supplements. So the joint supplement and those foods were removed. Finn continued to improve and to return to normal function with absolutely no pain from arthritis and disc disease. Because of this success, Michael and Maggie plan to start weaning Finn off of the Apoquel after the holidays. Next time Michael saw Finn 3 weeks later, Maggie told him that the pet sitter who had been watching Finn had forgotten to give him the Apoquel. Maggie said Finn had absolutely no itching whatsoever, and Finn had now been off of Apoquel for 3 weeks. He never had any itching issues again, even during pollen season in Charleston, South Carolina, where we talk about the yellow snow. So how thrilled is Maggie? How happy is Finn? And how big of a hero is Michael? The last piece is controlling inflammation, because any chronic disease, anything that ends in itis, like dermatitis, nephritis, gastritis, means inflammation. Supporting improved assimilation and digestion includes things you may already be familiar with, because if the gut is functioning normally, then the immune system is functioning normally, and we have a much lower level of inflammation. So primary things to do are to make sure you're feeding an anti-inflammatory whole food diet. We're working on healing the leaky gut, using a bioresonance test to determine food sensitivities, which is super simple because it's a hair and saliva sample you can take at home from your pet. And then using that test to develop a rotation and elimination diet so that the immune system in the gut never sees food for more than the same food for more than 24 hours in a row. And then we can use things like probiotics, gut healing supplements, and high doses of omega-3 fatty acids, turmeric, and there's a boatload of other options out there now, thankfully. This is Thunder. Thunder was one of my first patients when I was studying traditional Chinese veterinary medicine. She was a 6-year-old Mastiff with arthritis, and she really had a heck of a time getting up. She was very overweight. She was very grouchy because she just didn't feel good. Now, Thunder did not think acupuncture needles were a good idea, and so after a few attempts, I stopped arguing with her. So I said, okay, let's use some Chinese herbal formulas. She did not think that was a good idea either. However, she did think that eating home-cooked food and omega-3 fatty acids were a good idea. What happened over the next 6 weeks was astonishing. She lost a ton of weight. She went from barely moving to happy to go out for walks and indeed dragging mom down the road in times. So this was my first indication how powerful food is as a primary medicine. If you have any doubts in your mind how helpful changing your pet's diet can be from something commercial to something whole foods, whether that's raw, cooked, homemade, or pre-frozen, I want you to try it and check it out. If you combine that with a bioresonance test to make sure that your dog or your cat is not sensitive to certain foods, I think you'll find even better results. I want to thank you for your attention. And if you need help, if you need support, here's all of our contact information. And if you have a dog or a cat you're struggling to get answers for in terms of their health condition, I want you to know that holistic pet health coaches are there to help you. They have been trained by me personally to understand how to go through all of these mechanisms, all of these tests, and come up with a plan that will best suit your dog by changing its diet, providing an ideal supplement regimen, and helping you figure out the best questions to ask your vet if you need to go back to the vet. So if you want help with that, head over to drruthroberts.com, click on the tab that says Find a Coach, and see if you can't find a holistic pet health coach to help you. I want to thank you for your attention today. Again, these are really critical issues that we are all facing, all of us animals here on Earth, until we can begin to clean up our environments, I think it is absolutely critical that we do a daily cleaning within ourselves. There's a myriad of products out there for supporting detoxification, but I think we're going to see some more really amazing and effective ones come